The vaccine is coming, along with COVID's winter surge. Joining us on Columbus on the Record this week, Sam Gresham of Common Cause Ohio, Michael Miller, former Franklin County prosecutor, and Laura Bischoff, State House reporter for the Dayton Daily News. The rate of COVID spread is still high in Ohio. The state continues to see some 8,000 or 9,000 cases a day. On average, 3 Ohioans are dying every hour from COVID-19. Hospitalizations are up. Intensive care units in some hospitals are half full just with COVID patients. The state's COVID warning map shows 7 counties now purple, meaning severe exposure to the coronavirus. Franklin County actually dropped down a level to red in just very high exposure, but the county is still seeing a very high rate of spread. And we still have not seen the results of Thanksgiving travel visits yet.
This is not the beginning of the end. This is not even the end of the beginning. We are in a really difficult spot here when hospitals are already at their highest COVID levels and at high capacity across the state. And we're just heading into what the CDC director has described as the most challenging 3 months of this pandemic.
We'll start with Laura Bischoff, because at the end of the week, late this week, Governor DeWine outlined the first plan for how to distribute the vaccine. Now, the vaccines have not yet been approved by the FDA, but hopes are high they will be in the next week or so. And Laura, what's the main takeaway from the governor's announcement on vaccine distribution in Ohio?
You know, what's really remarkable is that between December 15th and Christmas, Ohio will get about 659,000 doses of either of the Pfizer vaccine and the Moderna vaccine, assuming that the approvals are granted, et cetera. That's the timetable that the governor laid out on Friday afternoon during a special edition of his coronavirus briefing. And those doses are going to go to frontline healthcare workers, EMS workers, and then staff and residents of nursing homes and assisted living centers.
Sam Gresham, do you think that makes sense? It's no real surprise. Healthcare workers first, and the nursing homes have been hit really hard by COVID-19.
Mike, it does make sense, but I still have a concern that the African American community and people of color are not in the right space. If you're 70 years old and you live in a poor neighborhood, you should be up in the system. Now, I know they have the Department of Aging, AARP, and the Minority Health Commission as a part of the process, but I haven't heard anybody identify those particular groups as groups they're going to have as high priority.
Laura, did the governor, he talked about Group 1A, so this is the very first batch, the first group that they're coming up with a plan. Did he get into any details what 1B, 1C, 1D is going to look like, or Group 2, or is it still too early for that?
It's still pretty early to get into that. The governor said that he's not really sure. He was asked at the press conference, you know, when is the 40-year-old person who doesn't have any major health issues going to be in line? And the answer was, we just don't know yet.
Michael Miller, you comfortable that people will get the vaccine? That's been a concern, that a lot of people just aren't so sure that it's going to be safe. It's been a real rush to get this thing approved. Medical experts say they're safe, but some are skeptical. Do you think people will take it and get the shots?
Well, I think most people will. I mean, I'm no more of a scientist than, I am a physicist, but I believe the experts. I'm one of these guys that believes in Dr. Fauci and the locally Ohio people that have given us that information. I believe that it's safe, and I intend to take it at the first opportunity. Now, there will be some people who do not do that, but there are some people who don't wear a mask and go out and so forth. So you're going to have a difference of opinion in this country, as we differ on everything. But I think the vast majority of people will take it.
Laura Bischoff, also in Friday's news briefing, it seemed like the governor came a little closer to maybe taking stronger actions than just pleading with people to wear masks and stay apart and stay home and go home at 10 o'clock. And he seemed like he's saying if things do not get better in a hurry, that he may have to take stronger action.
He's never taken stronger action off of his table. He has always said that a governor shouldn't rule things out. So we'll see. I think Dr. Thomas from Ohio State Wexner Medical Center said these are going to be some really tough couple of months coming up, and we haven't seen the result of the Thanksgiving holiday visits, and we will have yet to see what will happen with the Christmas and New Year's holidays.
Sam Gresham, even Democratic governors have been reluctant to do shutdowns again. In California, for instance, the governor there, Governor Newsom, is saying, okay, when intensive care units really start to fill up, then that's when we're going to have mandatory shutdowns. Is that the way to go, do you believe, or should the governor just do it now and shut things down to try to put a lid on this right away?
Well, the governor is trying to find a metric that they can use to justify where they're at. Our current governor is being tempered by the right-wing Republicans in the General Assembly, who are threatening him with everything from flogging and everything you can think of for just asking people to wear a mask and stay at home. This battle between the economics and the disease is insidious and stupid, but it is the fundamental foundation for this paradox that we're dealing with.
Mike Miller, do you think, I think people in my circle have, in the past month or 6 weeks or so, we are not going out as nearly, even we weren't going out a lot before, but we're not going anywhere now. Are you seeing that, even though the bars and restaurants have not officially been closed? They have to close at 10 o'clock in the evening now. But my guess is that they're hurting even without the restrictions, and people are not frequenting these places.
Well, Mike, I don't think there's any question about it. My wife and I are the same place. We've been out once since March 12th, and we do get carry out a lot. In fact, just last night we had carry out and went to a restaurant I like to frequent. And you could tell by just simply looking at the cars, there's nobody there. And this is a restaurant where you go in and get it. They've got it right at the front desk, pick your food and leave. And my wife goes in and gets it while I turn the car around, and she said it was just virtually empty. And this was like, 7 o'clock at night. And I think that's all over. There may be some doing a little better than others, but it's very, very difficult for the restaurants, and I'm afraid that some people are going to unfortunately close and never open.
Laura Bischoff, there was some talk this week, or a question was asked anyway this week, about is there anything the state can do to help these businesses, restaurants in particular, entertainment venues, and other things that have been hit hard by COVID. And the governor basically said it's up to the feds to pass a bill, right?
Right, and we all know that hasn't really gotten much traction in Congress in recent weeks. So, we'll see. I think Mike's right. The last press release I saw from the Ohio Restaurant Association said that some of their members are down like 70% in their revenues. Yeah,
I can just imagine. I know they got PPP funding, but it seems like they're going to need another round to survive through the spring for these vaccines to hopefully work their magic. Anyway, as COVID spreads quickly across the state and the country for that matter, Ohio lawmakers are moving to slow the state's emergency response. Lawmakers overwhelmingly passed a bill that would severely limit the governor from issuing quarantine orders. Governor DeWine vetoed it, but Senate President Larry Obhoff says he has the votes to override the veto, and the House may have the votes as well. Meanwhile, in what essentially amounts to a symbolic effort to attract attention, 4 Republican lawmakers filed a dozen articles of impeachment against DeWine for his actions during the pandemic.
I'd like for them to go in and talk to some nurses who are frontline nurses, who are dealing with people who are dying. I'd like for them to go talk to some family members, maybe a family that didn't believe that this could happen. Now at Christmas, there'll be one less person at their table or more. So at some point, this foolishness has got to stop.
I don't think I've ever seen Mike DeWine blow a gasket, but that might be as close as he's going to come. He seemed to be pretty annoyed there. Mike Miller, what's going on? Are Republicans losing any credibility that they had by restraining the governor now, or trying to restrain the governor now, when cases are going through the roof and so many people in Ohio are dying?
Well, you showed two things there. The impeachment thing, I think, is so ludicrous it doesn't even deserve to be commented on. I mean, people like that are just, I think, seeking of publicity and have no common sense at all. The other one is different. And as Sam spoke before, reasonable people can really disagree on this. I mean, I believe the last thing I saw is we had almost 7,000 people have died in Ohio. That's died now. That's triple the 9/11 losses and that type of thing just in our state. And yet we also know that, as Laura said about the restaurant people, they're really getting hurt, and many of them are going to be wiped out. They're two different things. Is the economy, is it lives? And I think the way DeWine has gone, in my opinion, is the right thing. And he's trying to save lives as best he can based upon the information he gets from his expert. Now, are there other people who are very bright too and think, well, it's wrong. We're ruining too many people's whole foundation, economic foundation, by doing this, and we've got to open this stuff up so they don't lose everything, and somehow tweak something to save the lives too. I don't know that you can do both, and I think the Republicans, in my judgment, I would rank what DeWine is doing as the right thing to do, that we've got to try and save people's lives, and hopefully maybe Congress and DC will get something out to the people who've been hurt so badly by this, as they certainly need the help.
Sam Gresham, no doubt lawmakers, Republican lawmakers, are hearing from their constituents, and that's what's driving their opposition. I mean, these folks are losing a lot of money, losing businesses, and struggling to pay their bills. And so do they have a point that the lawmakers should have more of a role in this than they do now?
I agree they need programs. I'm not sure if the lawmakers need any more involvement. What we need to do is get the Republicans in the Senate to pass some bills. What we need to do is make sure that there's funding for those institutions, restaurants, etc., to keep them going. It's not their fault that a pandemic exists, and they shouldn't go out of business as a result of that. But we also have another problem. That is the low information of certain congressional people, members of the General Assembly. And I mean, they really don't have the right type of information. That's a nice way of saying that. And then they're playing politics. It's doing what Trump wants them to do. And I think when the Republican Party post-Trump, they really have some problems they have to deal with. And Mike and I were talking earlier. I think they're going to have to rethink this thing, because right now they look like a joke.
Laura Bischoff, are they really going to override the veto, or is there room for a compromise between House and Senate leaders and the DeWine administration to come up with some kind of middle ground? Is there a middle ground when you're issuing emergency orders?
Well, it's interesting. Larry Obhoff on Wednesday said we have the votes to override, and we'll hold a override vote. And then on Thursday, he said he'd been in discussion with the DeWine administration, and they were talking about finding some common ground. I think one of the issues that Senate Republicans have is that there's it's all or nothing with these health orders. Either it's a criminal violation or it's not. And so there's some talk about maybe going with developing like more of a tiered response to health orders. So we could see that they kind of wave off on an override and they come up with some other compromise. And I would expect that probably next legislative session.
Sam Gresham, I mean, there hasn't been a poll in a while, I don't think, but the last poll that was taken was, I think in the summertime, 70% of Ohioans supported what the governor was doing. 70%, 7 in 10. But now at least 3/5 of the legislature opposed to what the governor's doing. Is this a real illustration of the effect of gerrymandering on the legislative process? In
You
that
bet your
there is
bit.
some
Right.
very minority that is driving policy.
Right, and those districts are holding them captive because they've made them so far to the Trump side, and they can't make decisions that affect people, but effectively. But I'll say, like Mike, my wife and I, if they open the doors as many times as they want to, I'm not going. I'm staying at home until I get my vaccine and I know it worked. So even forcing people to open their doors won't solve the problem.
All right, our next topic, the only movement on the effort to repeal and replace the scandal-plagued nuclear bailout law is a bill to delay the subsidies for a year. The sponsor of the bill said it would give lawmakers time to study the issue further. Democratic opponents call it a stalling tactic. While the law mainly helped First Energy, a First Energy subsidiary, it turns out Columbus-based AEP was involved in helping get the measure passed. As first reported by the Dayton Daily News, AEP donated $900,000 to groups linked to the bribery scandal. Laura Bischoff, you broke the story this week, linking AEP to Generation Now, the group that helped get Larry Householder elected as Speaker and then helped the legislation passed to bail out the nuke plants. What does it say that it's more than just First Energy that wanted this bill to become law?
Well, that's assuming that AEP's empowering Ohio's economy, this 501c4 that it set up and funded, assuming that they knew that Generation Now was definitely after House Bill 6. And also think that like some of these contributions came over 2017, 18, and 19. Yeah. And the bill wasn't introduced until April of 19. But that said, it tells me that Generation Now was, of course, a vehicle that was controlled by Team Householder, according to the feds. It tells me that organization was very aggressive about fundraising and looked to utility groups for checks. And what's not disclosed is exactly what Generation Now's funding pitch was when it approached that nonprofit.
Does delaying these subsidies for a year so they won't show up on our electric bills in January as they are supposed to, delaying the payments to First Energy or to the subsidiary that now controls those power plants, is that a good move to give us some more chance? Maybe look at the books of First Energy. Do they really need this bailout?
No. In fact, it's the wrong thing to do. We're dragging this thing out. We need to clean it up, get it off our books, and have a new approach. What they're trying to do, what they're saying to me as a public, we still want to give these people this money under this situation, and we're going to find a way to delay the decision making until people forget. And then we're going to do what we want to do. This is one reason people don't like government. We need more transparency, particularly in the area of utilities. We don't have this. And this is an example where the federal government, FBI, came in to clean up what the PCCO should have dealt with initially. So our system is really faulty. Our system is really weak because we don't know where all this money comes from. And look what it got us into, a $60 million scam.
Laura, is this going to get repealed and replaced before the lame duck session is over, before this session of the General Assembly is completed?
You know, I don't think it'll get repealed and replaced. I think more likely is that they're going to do this delay. That's the approach that seems to have the momentum and the backing of legislative leadership in the House. The Senate President Larry Obhoff told me this week that he prefers that the bill just be repealed, but if they aren't able to come to an agreement on that, then at least delay.
Well, Democrats say this is, to use a phrase, kick the can down the road. Will it really much change in a year from now, do you think? Or do they hope we all forget about it?
Right, and you know, the other thing is it doesn't seem that the voters really punished these lawmakers who voted for House Bill 6. It seems that you know, their strategy of hoping everyone forgets, maybe it might play out.
Mike Miller, were you surprised by that? I mean, that it wasn't a bigger issue, that voters really didn't seem to care much that the Speaker of the House had been, you know, dragged out of his house in handcuffs and, you know, had a perp walk in front of the federal court and faces a bribery and racketeering charge? It just didn't seem to catch on, whether it was because of Donald Trump, you know, just overshadowed everything or whatever.
Well, I can't say that it surprised me, Mike. I really didn't know how it would turn out. I think Laura's right. They didn't seem to penalize them for one reason or another. Maybe other reasons they had to vote that way overcame distaste they had for this. I don't know what they're going to do on this bill, of course, but I think you've got to repeal it. Perception is everything. I'm sure that there are things in this bill that are good, but it doesn't make any difference because of the belief out there, how it was passed and so forth, which I have no problem with that belief. No one's been convicted by a trial or in a court, but I just think the perception is so bad that they've got to get rid of it and start all over again.
All right, our last topic. Tell me if you have heard this before. Lawmakers have a plan to finally fix Ohio's public education funding system. Well, the House has a plan. Of course, it is complicated, but it basically creates a new, simpler formula for deciding how much it costs to educate kids in a school district, how much a school district can afford for its schools, and what the state would have to contribute. It's not only complicated, it's costly. By the time it's fully implemented, it would cost the state about $2 billion a year. Some say as money as $4 billion a year. And that's why the state Senate will not act on it, and lawmakers will basically have to start over again next year. Sam Gresham, it's a very complicated formula, but this seemed to be, from what we read and lawmakers' perceptions of it, the closest we have come to having a fair formula. Do you think this is a step in the right direction, even if it doesn't get passed till next year?
Well, I want people never to forget DeRolf and what the Supreme Court said about the resources that should have gone to schools. This comes halfway in responding to that, but its complexity makes it very difficult to understand in its transparency. Now, I like that it identifies student need and the actual cost of providing that. It provides 70% of the increased dollars to the most impoverished schools, and funding needs to be directed to, and they have some language in there, social and emotional learning, as well as test proficiency. Those are the things that I like about it. Now, we can get down to the formula not being as complex and keep those things in. I think it's good for the general community.
Mike Miller, education funding comes down to tough decisions that lawmakers have to make. Some districts are going to do well. Some districts are not going to do as well. They're going to suffer a bit. And in all likelihood, the state's going to have to kick in a lot of money, and that might even mean raising state taxes. Are lawmakers ready to do it this time? It's been 27 years since DeRolf. Mike Miller?
Well, from what's happened recently, they appear to be ready. And even with this thing they have, the structure of the new bill and so forth, people are complaining. And, you know, I understand that. We all understand it. One group feels they're not getting enough, and the other group feels they're getting too much. But be that as it may, I think we may have something happen this time. I don't know it'll be the end of it. There may be changes in a year or two. We'll see. I know there's a lot of money involved, but they seem to be determined to do something. They've worked on it 2 years, and it's out of committee, and I think we'll see something.
Laura Bischoff, I know you haven't been covering this as closely as other issues, but Mike just said it. They've been working on this for 2 years, and it gets approved the first week of December with 2 weeks to go in the legislative session. What took them so long, and can you blame the Senate for not wanting to act on a $2 billion a year item with 3 days to go in the session?
You know, it strikes me after covering the legislature for the last 20 years that lame duck stuff comes in two flavors. One is the ones that go through like grease lightning, and they want it to happen, and it's going to happen. And then there's ideas that may be good and well thought out and researched, but they cost too much, or they just don't have the political backing that they need to get over the finish line. And I would think that this school funding plan probably comes in the second category.
Yeah, one of the champions of it is being term limited, right? Mr. Representative Patterson is not going to be around next session. So, all right, time now for our final off-the-record parting shots. Mike Miller, we'll start with you.
Well, I love the political spin that everybody gives things on both sides of the aisle, and I think it took the cake here. I saw where the Democrat chairman, in talking about the election, the national election, even though Ohio went to Trump by 8 points, he felt they did a really good job in contributing to the Biden win by forcing Trump to come to Ohio a few times and not going other places. I just thought that was an interesting way to look at it.
All right, Sam Gresham, your final thought.
I don't think the vaccine is going to be a slam dunk in the African American community. Given the history of Tuskegee to now on how vaccines have been used or healthcare programs per se, there's going to be a lot of reluctance on the part of the African American community. The federal government and the state government needs to put some educational programs together to educate people in the African American community.
And Laura Bischoff, final thought.
You know, I don't think that Governor DeWine's Strong Ohio gun package is going to get adopted. And instead, I think that there's going to be some pro-gun rights legislation, including Stand Your Ground, that will make it through to the finish line.
All right, my final thought, I interviewed David Pepper, who Mike Miller just referenced there, the outgoing head of the Ohio Democratic Party. He did say that it was a part of the strategy in hindsight that helped Donald Trump lose the presidency was Biden not paying attention to Ohio. But anyway, he also said that he might run again. So look for him as a possible statewide candidate in 2022 or in the years ahead. You can check that out on our podcast, Snollygoster. Also check us out online for this show, wosu.org/COTR. For our crew and for our panel, I'm Mike Thompson. Have a good week.